Hi, I'm Mike, a year 3 physio student from CSU. I'm here to hand over about Miss Catherine to my teacher Amy. Miss Catherine is 34-year-old patient who come in here with a goal to deal with her chronic pain in her hip, pelvic, and lower back. Miss Catherine have a partner and two children. She started experiencing lower back, hip, and pelvic pain during second pregnancy 2 years ago. Now, she have pain mainly in right hip, lower back, and pelvis that flare up throughout the day and affecting her life. Other significant medication history that she was diagnosed with depression and was prescribed medication. Currently, she is only taking anxiety medication. So with that, I have two hypotheses. My first hypothesis is chronic unspecific back pain. She reported on the back pain start during the second pregnancy and continue on postpartum period without indication of recover. Based on the aggravating factor that happen anytime stuck staying in one position too long or activity with repetitive movement like carrying her children or bending down to pick up her children's toy. It is hard to determine the specific issue of causing pain in her lower back. Um, Many research have indicated that depression and pain share the same neurochemical pathway, and that uh, it increases the risk of lumbopelvic pain by threefold for the pregnancy um, woman. So her unwell mental health can exacerbate her lower back pain. When Catherine was suffering from depression, she may not be able to do exercise, thus unable to strengthen her muscle function in postnatal period and getting back to the healthy weight. My second hypothesis is diastasis recti abdominis, DRA. She had reported about her stomach separation post pregnancy. So research have suggested that DRA happen more common in women have multiple pregnancy. Additionally, during her second pregnancy, she more likely continued to live and carry her first child, thus increase the strain on the abdominal wall and weaken it further during pregnancy. Catherine did not mention whether she is exercised during her pregnancy, and it is unfortunately that lack of exercise during pregnancy is also associated with increase of DRA risk. So with the recommendation, I have two of them. My first one is I'm planning to use the active and passive range of motion to assess her lower back pain. So the AROM aim to assess functional movement capacity as well as identify movement pattern and compensation as well as detect when pain flare up in the movement. While PROM is aimed to find the difference between the joint or muscle restriction, assess and feel quality and the range between P1 and P2. By performing AROM and PROM, we can establish the baseline for Miss Catherine range of motion, as well as we can understand how her brain trigger from feeling discomfort to brain become too much in a certain movement or certain motion. And this will help us to guide the development treatment plan for her. The second recommendation is a curl-up palpation. It is a common assessment to use to assess the integrity and function of the linear L-bar. The research have looking into this assessment, and is this one will help to identify the present location and severity of DRA with palpation and tape measure. Although it may not replace the accuracy of the ultrasound measurement, but it still show a valid readout that physio can record as a baseline. From then, we can set out a goal with exercise that help her recover, as well as the improvement from her baseline result will motivate her to continue on with the program. And that is the plan for our next appointment with her. And that will be all for today. Thank you very much. Bye.